Hi, I am Felicia Lopez. My research mentor is Dr. Suanchu, and this is Biomaterials-based gene therapy for Alzheimer's disease, our little presentation that we've both been working on. Degenerative disorders. There are many. There's Parkinson's disease, PD, Huntington's disease, HD, amyotrophic lateral sclerosis, ALS. This is famous because of Stephen Hawking. You may have heard of him. Dementia, multiple sclerosis, and don't forget about Alzheimer's disease. As you can tell in this photo, well, in this picture, you can tell they all have something in common. They all deal with the brain, but they have their own little things that make them very different. What makes them unique? Alzheimer's disease. It is a common form of dementia. Currently, 3 in 100 individuals worldwide are currently suffering from AD, which should be alarming. It may not seem like a lot, but that's a lot of people worldwide. The annual numbers are expected to increase by the year 2050, 12 per 1,000 individuals, which should be scary because that's a lot of people. Alzheimer's disease can be classified as familial AD or sporadic AD. While they share clinical and pathological features, including progressive cognitive impairment, plaque deposits in the brain, axonal transport defects, synapse loss, and selective neural death. Only 5% of the AD cases are of familial type, whereas 95% belong to sporadic AD. As the disease progresses, more changes occur in the personality and behavior of the patients, and they need extensive help. While daily activities, shrinkage of the brain over time results in more signs of AD, such as decline of thinking and reasoning skills, inability to respond to the environment or to control movement. As you can tell in this picture, there's mild cognitive impairment, some of the first stages, duration 7 years. Disease begins in the miotemporal lobe, which is very, very significant because it deals with memory and stuff like that, and the symptoms are short-term memory loss. In mild Alzheimer's, duration 2 years. Disease spreads to the lateral temporal and parietal lobes. Symptoms include reading problems, poor object recognition, poor direction sense, which is where, as the disease progresses, it's only going to get worse. Moderate Alzheimer's, as always, it's 2 years. Disease spreads to frontal lobe, so instead of from the middle to the back, now it's going to the front, which should be very alarming because the brain is very powerful. It's very powerful, which leads to poor judgment, impulsivity, short attention. As we'll get on later on, we're going to have more of the symptoms, factors, all as it goes on. Severe Alzheimer's, 3 years. Disease spreads to the occipital lobe, which causes visual problems, which later on, many people die from this disease because of all the factors and, complications of what ends up happening because of the disease. All the damage that's irreversible damage that has been done. Factors that could lead to Alzheimer's disease: this family history, gender, environmental toxins, head injuries. Other factors: high blood pressure, high cholesterol level, low education level, lifestyle, and age, which a lot of people are very familiar with. Aging is a factor of AD because the majority of patients who have this disease are often in their late 60s, and some patients have this disease in their 30s, which should be very surprising because this disease is known for a lot of these people who have this disease are already in their elderly years. 1 through 6% of the AD cases emerges in 30 to 60-year-old people, which is known as early onset AD. Late onset AD occurs in people older than 60 years with 90% prevalence, like I said before. Genetics can also be a factor because in some cases, if a family member has a neurodegenerative disease, there's a higher chance that other members of the same family will also begin to show signs. So if one has it, there's a higher chance that it's going to be passed down, as you can tell in this from what I went on before. Symptoms of Alzheimer's disease. Now, this is just a few of them, not all of them, because it would have filled up the entire slide. There are 5 early signs and symptoms of Alzheimer's: confusion with time or place, memory loss, poor judgment, hard to complete familiar tasks, changes in mood, like it says over here, dementia, memory loss, confusion, mood swings, disturbed sleep. This is only part of it. This isn't everything, but as you can tell, as time goes on, this is only the early signs. As the disease progresses, it's only going to get worse, and this leads to more complications. The main cause of Alzheimer's, as you can tell in this picture, this should be self-explanatory with alpha, beta, APP, with all these things that are going on, as you can tell. Scientists have proposed three main causes. It can be due to dysregulation of the cholinergic system, which is related to cognitive impairment of the patient. Alternatively, AD can be due to accumulation of NFTs or deposition of AB peptides in the brain. So I hope this makes a little bit more sense with this picture of what I'm saying, like with the NFT tangles, since this is all in the brain, as you can tell with from over here, and the Y secretase, the AICD. I hope this makes a little bit more sense, like being able to see it visually. Gene therapy. Gene therapy is a technique that is vastly used in the medical field or to help edit out a faulty gene. This is usually done, like you probably heard of CRISPR and other gene therapies, but CRISPR is the most famous because it's used, currently. Well, what's in style. The delivery of a therapeutic genes, such as those that can address these main causes of AD, may be a promising approach to treat this disease. Current gene therapies only help to alleviate the symptoms, but very few help to try to reverse damage done by AD and many other neurodegenerative diseases. So this is just to, make the patient more comfortable since very, very few help to reverse, because majority of the damage is irreversible because of the neurons, a lot of the things that are going on in the brain. As I mentioned before, the little baby steps into making the disease even more lethal, making it even more complications that are going to be going on as time progresses. There's reprogramming factors, fibroblasts, 80 patient-specific iPS cells, which is also part of the brain, differentiation, maturation, neuroinflammation, immunotherapy, the new drugs. This is all like a little the little system, like what goes on, like in a sense, like with gene therapy. This helps with visually the neurons, the iron microglia, stem cell therapy, regenerative medicine. This should help more or less like taking the little baby steps, if you will. Biomaterials. The activity of the gene must be maintained, and the delivery of the gene need to overcome the many obstacles in the delivery routes. There's more than one delivery route in the brain, specifically. The utilization of properly designed biomaterials can help protect the gene from the harsh environment and aid in overcoming the obstacles during the delivery. This will result in increased activity and availability of the drug at the target delivery site. So like I said, there's more than one site. There's different ways biomaterials can help. You probably heard of these, with polymers, ceramics, semiconductor materials, metals. They're used for a variety of things, like skin cartilage, ocular implants, like with the eye, bone replacements, heart valves, like if a patient has a heart problem, dental implants, biosensors, things like that, like how this helps, like how we see it in daily life, more or less. The objective is to review literature to evaluate the current state of biomaterial-based gene therapy for the treatment of Alzheimer's disease, specifically to design an improved biomaterial-based gene therapy strategy for the treatment of Alzheimer's disease. Since, like I said before, it's a very huge number, and it's only ever increasing by the years. This should be alarming for a lot of the scientific community and a lot of people, because the more these people have it, the more we need to work on how we can slow down or help, eradicate the disease entirely. The other objective is to prepare a review article, Biomaterial-Based Gene Therapy for the Treatment of Alzheimer's Disease, as titled by the PowerPoint. Future work in the lab, hopefully by next semester this gets done. Hopefully with the whole pandemic, hopefully this gets resolved. to develop a biomaterial-based gene delivery system for the treatment of Alzheimer's disease based on what we learned from preparing the review article. So these are just taking the baby steps into, hopefully working in the lab next semester. And I hope you really enjoyed all of this because it took a very long time to get here. Just saying.